Mr. Rack, good afternoon. My name is Joe DiGirolamo. I'll be your nurse today. How are you doing?
I'm fine, Joe. How are you?
I am well. So I just wanted to confirm some information. I know the LPN had come in and taken your vital signs and so forth.
Yes.
So your blood pressure is 116/68. Heart rate is 74. Your respiration rate at that time is 16. Your pulse oximeter reading, your oxygen saturation, is 97% on room air. So far, all these numbers are falling within expected limits.
Okay.
Your temperature was 98.2. Now, before I get any further, I would like to confirm a couple things. What is your full name and date of birth?
George Rack.
Okay.
My date of birth is January 4th, 1945.
Okay, and how would you like to be addressed? By Mr. Rack?
No,
or
you can call me George.
George? Okay, excellent. Now, I must ask you, do you have any pain at this time?
None whatsoever.
All right. Do you have any shortness of breath or palpitations in the chest area?
No, sir.
Perfect. So what we're going to do today is do a very focused examination on your cardiovascular system and your peripheral vascular system. So we're gonna take a look at the blood flow through your heart and through the veins throughout your body.
Okay.
Okay. With that being said, if I could actually have you lay down. All right, excellent. So right now I'm looking at the symmetry of your chest. Your chest is very symmetrical. There is equal rise and fall of the chest. I'm not seeing any paler color within your skin. And also I don't see any cyanosis, any signs of blueness or lack of perfusion in your skin. I just want to check your capillary refill here. So I'm just gonna check your blood flow through to your finger, just squeeze it a little bit. And excellent, that's less than 2 seconds. That falls within expected limits. I'd like to have you turn your head to the left side. What I'd like to do is just measure. I'm taking a close look at your internal jugular vein here. I'm just looking for the pulsation. Okay, and then what I'm going to do is actually get a measurement here. Bear with me, I'm just going to get a measurement. And this is just an estimate. Okay, that is around 2 centimeters. So that is absolutely excellent. Your jugular venous pressure is around 2 centimeters. That is within expected limits. It should fall within 3 centimeters. Yours is 2. It's well within expected limits. So the next thing I'm going to do is just feel for your pulses. I'm going to check your carotid pulses. Okay. Okay, and that is 2+. That's within expected limits. They are palpable. Okay, that is 2+ as well. Expected limits. The next thing I'm going to do is just listen for any turbulent blood flow through your carotid arteries, okay?
Okay.
I'm going to be listening for bruits, turbulent blood flow, okay? Right. So just turn your head to your left and just hold your breath. Okay, release. Good. And the other side. Breathe. And hold your breath. Okay, breathe. Excellent. I'm not hearing any bruits at all. That is absolutely excellent. No turbulent blood flow there. The next thing I'm going to do is just palpate your chest area. And I'm feeling for turbulent blood flow. I'm feeling for anything called thrills, heaves, or lifts, which would be an indication of turbulent blood flow. I'm just palpating near the aortic valve. Okay. Don't feel anything unusual there. Pulmonic valve area. Okay. Erb's point. Tricuspid area. Not feeling anything here. Now I should feel point of maximal impulse. I should feel near the mitral valve, near the apex of your heart. I should feel the beating of your heart here. And it's actually accentuated if you roll to the left side a little bit. I'll be able to feel it a little bit stronger. Okay. Okay, excellent. Very good. Okay. The next thing I'd like to do is just palpate, and you can just relax. I'm just going to palpate your aortic area here. Okay. Okay. And I'm just going to measure the distance. Okay, now bear with me. I'm trying to estimate the size of your aorta, the width of it, and it should be within 3 to 4 centimeters. And that is definitely within, well within 4 centimeters. It's about, let me just see here. I have my handy dandy tool here. That is actually 4 centimeters, okay? 4 centimeters, and I'm just gonna palpate your femoral arteries. I'm just gonna reach in, not expose you at all, okay? Okay, 2 plus, again, plus, excellent. All right, the next thing that I'm going to do is just listen to your aorta for bruits, again, turbulent blood flow. Okay. And I'm also going to listen to your femoral arteries for bruits or turbulent blood flow, as well as your renal arteries for turbulent blood flow. Okay, so bear with me. Okay. Gonna check your renal. Okay. Okay, excellent. Nothing there. And then just your femoral. Okay, good. Excellent. I don't hear any turbulent blood flow, any bruits in the aortic artery, the femoral arteries or the renal arteries. That is really good. Okay. The next thing I'd like to do is just palpate your pulses, your popliteal pulses. These are your arteries behind your knee. Okay. So I just want you to slightly bend your knee. Okay. Excellent. 2+, good blood flow. Again, 2+, good blood flow. Okay. I'm going to palpate your posterior tibialis. This is an artery near your ankle area here. Okay. 2+. Again, the other side. 2+. Okay, I'm just going to take off your shoes if I may.
Sure.
Thank you. And I'm just going to palpate your dorsalis pedis pulses. These are the pulses that on your instep. Good, strong, 2+ pulse. Good, strong, 2+ pulse. And I don't notice any edema or swelling in the lower extremities. It looks like you have hair growth on your toes, which is a good sign of good blood flow. The other thing that I like to do is just palpate your radial pulses and your ulnar pulses. These are the pulses around your wrist area. Good, 2+. Good, 2+. Good. 2+. Actually, that's a 1+. A little weaker there. And 1+. Not too bad. Okay, so if I could have you sit up. Okay. I just want to palpate your brachial pulses as well. Good, 2+. Good, 2+. Okay, excellent. So with that being said, I'd actually like to listen to your heart sounds, okay?
Sure.
All right. So, gonna listen in the aortic area. Pulmonic area. Erb's Point. Tricuspid area. And now the mitral valve area. Alright, and I'm also going to listen mid-axillary near the fifth intercostal space, just for mitral valve regurgitation if you have any. And I don't hear any regurgitation. But I do actually hear, and I'm going to listen again with the bell side of the stethoscope, I am hearing a right-sided systolic heart murmur right in the aortic area. Has anyone ever diagnosed you with that?
I have had a heart murmur since 1961 it was diagnosed.
Okay. And I see that you don't have any surgical scars, you have never had any heart surgery or stents or any mechanical device placements, correct?
None whatsoever.
All right, excellent. So I'm just going to listen one more time, but this time what I want you to do is actually lean forward. All right, and what I want you to do is when you take a deep breath in the next time, I want you to hold your breath. Okay, release. Excellent. I'm going to have you lean forward yet. Good. Okay, excellent. The reason why I had you actually hold your breath after you, upon inspiration, after you breathe in, a right-sided heart murmur is accentuated more so. In other words, I would be able to hear it more so as I did if it's a right-sided heart murmur. So that's why I did that. So what I'd like you to do is, I know you have trouble squatting, okay? From our past conversation.
Well, I may not be able to go all the way down, but I can squat to a certain degree, and you can let me know if that's good enough.
Okay, how about we start by standing first? I just want to listen to your heart sounds standing, and I'm looking at the color changes in your skin. There's really no color change, which is good. And when I palpated and felt your arms and your legs, your skin is dry, normal temperature to touch. It's not cold, it's not extremely warm, which really indicates good blood flow. Okay, so again, I'm going to listen to your heart. Okay, this time what I want you to do is, when you breathe out, I want you to hold your breath. Okay, thank you. Okay, when you breathe out, I want you to hold your breath. Excellent. Breathe again. Perfect. Now, if you are able to safely squat without hurting, good. And you can breathe normally. Okay, excellent. The last thing I'd like to do is just listen to your base of the lungs in the back. Take a deep breath through your mouth, open mouth, and exhale. Deep breath again. Good. Deep breath again. Excellent. By all means, have a seat. George, really, you have there's no indication of turbulent blood flow. Your pulses, your arterial pulses, within expected gradings, if you will. And the only thing I detect is really the right-sided systolic murmur, which there are many people that have systolic murmurs, so I'm not too concerned about that. What I would like to do is actually perform like an EKG on you as well.
Sure.
So this basically concludes our general cardiovascular and peripheral vascular assessment. What I'll do is actually have the LPN come in and perform the EKG, and then we'll take a close look at that, and hopefully everything checks out, which I'm sure it will. You don't you never have you ever had palpitations or chest pain, shortness of breath like that?
No, never.
All right. George, I thank you very much.
Thank you very much.
You're welcome. Do you have any questions or concerns?
You've put my mind at rest. I'm good. Thank you.
You're welcome. Thank you.